Hi, my name is Dr. Raja Adnan Ahmed, and I am with Dr. Suhail Ahmed Khan, who is a radiology SC2 trainee. And this session is about how to get into radiology training. And it is very important. I think a lot of IMGs have been asking me about radiology and some other specialties which IMGs initially find difficult to get into. So I thought it would be a good idea to get a fresh trainee from radiology who is also an IMG to tell us how to go about and how to improve your chances of getting into radiology. So Suresh, first of all, thank you very much for joining me and giving your time. I know you are doing a very good job.
No, absolute pleasure. Thank you for organizing this, and you've been helping a lot of people. So I'm just happy to pitch in. Thanks.
So, Suresh, to start with, if I ask you, what is the procedure of getting into the radiology training?
So the procedure is more or less straightforward now. I can talk about how difficult it was historically, but let's talk about how the situation is right now. So right now, if you're an IMG and you need to clear your PLABs and be GMC registered as per other specialties, but once all that is done, first thing you need to do is apply for radiology itself. This is done by the ORIEL website, and the applications open in November. The application process itself is quite straightforward. You just have to put in your details. What they're looking for from the recruitment end is whether you're a qualified doctor, and that's about it. They're not looking at anything else. So once you apply and your application is successful, that's around November time. I think around December time, you'll get an invite asking you to write the MSRA recruitment exam. That's medical specialty recruitment assessment. Now, once I think we can talk about this exam itself in more detail if it's required. But talking about the process itself now, once the MSRA exam is done, usually the first 600 candidates who scored well in the exam are called for the interview. And once the interview is done, around half, about 300 seats or so, successful candidates make it through. So it's application, MSRA, interview, and then if you're successful through all of this, you get your placement.
I just wanted to mention here, I think you said you need to have BLAB and GMC registration. I believe you also need the CREST form, the Foundation Competencies by this time.
Yes, absolutely. Yeah.
So what is the interview process like itself? You know, how many stations were there and how many obstacles you have to go through during that time?
The interview process itself, the way it's structured is quite straightforward. There's a self-assessment station where they give you a piece of paper with written subcategories such as audits, research and publications, any previous examinations, etc., where you have to self-assess yourself and give yourself marks. And then there is a commitment to specialty station where there are two consultants usually sitting, asking you questions, basically trying to find out how much you actually know about radiology. They're trying to differentiate between candidates who are just applying and those who are passionate and actually know about the subject a bit. They won't ask you too much about the radiology academically, but they'll ask you things about, like, how many exams do you have in radiology? How do they assess you in radiology? How many courses have you attended? So things revolving around commitment to specialty. After this is your portfolio station, where they look at your CV and you have to make a detailed portfolio showing all your certificates and proof and evidence of what you've done previously. And they'll ask you questions regarding that. And they'll also look at your self-assessment form, if you've assessed yourself properly or not. And based on this, your score is given.
That's good. I just wanted to say that since the coronavirus came, a lot of the face-to-face interviews are not happening. So, recruitment process might change. They may apply the same principles, but the interview might not be face-to-face. For that, we might have to wait for the recruitment office to tell how they are going to do it this year.
Yeah.
One of the more important things you said here, that they check your portfolio and commitment to specialty. So this is important for an IMG to know, because especially if they are a medical student now and thinking of radiology, or even they are a junior doctor within their home countries or within UK. So what should they be doing to improve their chances to get in radiology? What can they put on their portfolio? What are the things they need?
I think the most important thing, the first step I would advise personally is once the GMC registration and the CREST form is done, is to have there's something called a taster session. Um, Now, this IMGs might not be familiar with because we don't use that terminology, but people who are training here would be quite familiar with what a taster week is. So basically, you request the radiology department wherever to come in to see whether you can shadow consultants and registrars for a week or so to get a feel of how the department actually works. Now, what this taster week gives you is an opportunity to interact with registrars and consultants and give you an insight about what actually people did to get into radiology. Because, I mean, someone might be training in third year right now, a medical student, or someone might be just applying right now. So year to year, things change slightly. And the easiest way to have up-to-date knowledge about how the people made it is to interact with the registrars directly to see what they did. And also another tip is that once you do these taster sessions, a lot of the senior consultants would have been in the interview panel at some point in the career or the other, and they can give you some useful insights, which is invaluable. So first thing I would recommend is once your GMC and CREST form is sorted, to get a taster week, get inside information from the trainees and the consultants of what needs to be done, and get cracking with it.
And are there any courses or any other things, that because a lot of people recommend that do some sort of audit or some sort of presentation that is linked to it,
Yes.
especially that can improve your chances.
Yes. So in the portfolio station, this is where it's assessed, like your research, your audits. This is where it comes into more of a play. Again, I'm from India, and I know for a fact that audits are not done as regularly over there as they're done over here. It's hard to get an audit done. So I'm sure it's similar, or if not the same in Pakistan as well, or other IMG countries. So what I would recommend is when you come for the taster sessions, ask the people around for audits. They'll give you simple audit ideas that can be done, and often it can be done within the department itself. So choose an audit from within the department and get it done quickly. Audit is important because it gives you the weightage for your final mark is quite a bit. So it's a really important process. And if you don't have it, you give a really poor impression on in the interview panel itself. So once you're doing the taster session, ask for an audit idea, and they'll gladly give you always audit things going around, and they'll be happy to give you one. So audit would be one. Research paper, as you asked, is a little more difficult, but of course, if it's done, it's a great thing. This need not be within the taster session itself. If you can ask someone around and have any radiology related paper done, that would be absolutely brilliant. But that's something more difficult to get by, but not impossible, of course.
And any courses or conferences that you can recommend, or any place they can look for?
There are lots of courses going around. I wouldn't recommend one over the other. The courses are important because they show that you're committed to the specialty, and this is one of the interview stations asking specifically for this. Once you come here, there are lots of there are interview courses that go on who teach you about how to perform in the interview itself. There are other courses that teaching courses such as chest X-ray courses that are going around. There are also lots of conferences that you can attend to show your commitment to specialty. I wouldn't recommend one or the other. It depends on your personal situation, what you would want and what you don't want. But the bottom line is you need at least 2 or 3 of these under your belt for the interview.
So so far you told us that after getting GMC registration, you can get the CREST form signed and apply for the training, and then by the time you get longlisted, you will be asked to sit in the MSRA exam that will give some weighted to your application, and then you can have the interview station. And so far, since last year, there were 3 stations. One was around your commitment to specialty, one was about self-scoring yourself against the criteria, and third one was about your portfolio. Is there anything I'm missing on that?
No, that sums it up more or less. Just the other thing I want to add what MSRA is. Not only is MSRA like a screening test for your interview, but it also adds to the final score of yours. So I think it's about out of 120 in total, the 3 stations interview are 40 marks each, and the MSRA score itself would be 40 marks. How they converted this in final score is beyond, most people don't know how they convert the final score, but 1/3 of the MSRA score, 1/3 of your final score will be from MSRA. So it's not just a screening exam, it also counts to your final score.
And if we talk about the training itself, so how many years of training is in UK?
So yeah, so if you're training fresh from as a trainee from UK itself, from the start, it's 5 years. Unless you're doing intervention radiology, that would add an extra year, so that would make it 6 years. And any fellowships, of course, will be after that. But the core training itself is 5 years.
And how many exams do you have to go through? Because that is another important aspect people ask for.
Yeah, so I will talk about each exam. In the broad picture is that we have the first part, you have 2A and 2B, so the 3 exams. But the first part consists of 2 papers. It's anatomy and physics. You are expected to give this within about 6 months of you starting your training. So anatomy and physics is the first one. Second is 2A, where it's about the clinical. It's more clinical exam. You won't have any pictures or any radiological related images as such. It's more similar to MRCP, I would say, where they give you clinical scenarios and you have to try and crack the question according to that. And the last 2B is the Viva exam.
I think it's important to mention a lot of IMGs get confused from Pakistan, at least I've seen. They believe that you first have to pass a part of the exam, first part of the exam, and then enter training. It's because this is a system we are used to in Pakistan, that you cannot enter the fellowship training in radiology until you pass the part 1. But here you can enter the training and then start doing the exam afterwards. Is that right?
Absolutely, yes. That's what's expected actually. First you get into the training and then you clear your exams. Yeah.
And what is the training like? Because a lot of IMGs would ask you. The question asked is around the work-life balance, and what is the on-calls like? How are you finding the training? Is it something that you enjoy and you get time for yourself and your family as well?
Well, I have a pediatrics background, so I can compare how life was in pediatrics and radiology, and I would say the work-life balance is not even comparable. I mean, if you think about it, radiology doesn't have handovers as such. So you leave on time, you come on time. The work-life balance is absolutely amazing. You leave absolutely in time, and the training time itself, there's lots of face-to-face training with the consultant. Like my day-to-day life, for example, I'll be reporting scans and I'll send them to a consultant for verification. And then later in the afternoon, in the evening, I'll actually sit down with the consultant and go through each scan, and they'll teach me what I've done well or where I could have improved myself. So the face-to-face teaching is something that's very rare, and that's in other specialties, and that's very common in radiology on a regular daily basis. So both from a training perspective and from a work-life balance, I think life is amazing in radiology.
And what is your on-calls like?
Yeah, so not everything is rosy. On-calls, very commonly you'll see that the radiology bleep or the phone is the busiest in the hospital. On-calls are really, really busy because you, depending on what kind of work system the hospital has, you're often the only person or the one of two person who's answering all radiology calls when you're on call and reporting as well, and you're reporting acute stuff. So on calls become really, really busy. I would say it's probably the busiest in the hospital. It's not physically demanding because you're sitting in one place, but definitely mentally it's quite exhausting.
And one of the things you mentioned about the subspecialties within radiology, because somebody like me or somebody who's a new IMG or a medical student, radiology might look like one single specialty, but I know there are different kind of subspecialty within that. So could you tell us the basic idea of what are the different subspecialties within radiology?
Yeah, that's a very good question actually, because as you said, even in India, the subspecialty culture hasn't really come up yet. But in UK, within your training itself, so first 3 years you do a general radiology course, and the next 2 years you're meant to subspecialize. And subspecialties itself, they include things like GI radiology, gastroenterology radiology. You have chest radiology, where you're dealing with lungs and the heart. You have MSK, musculoskeletal, and you have intervention radiology. Another subspecialty is pediatrics, pediatric subspecialty, where you do everything that is pediatrics. Interestingly, you can even go further in pediatrics. You can do pediatric, say, pediatric GI or pediatric neurology. The other subspecialties would include intervention, as I mentioned earlier, but that would be an extra year of training itself. And you can do breast, only breast, or you could do breast and gynac. And the interesting thing is you can actually, at least as per the current training scenarios, you can tailor your subspecialty training as per your interest itself. So suppose you're doing vascular under IR, you can choose not to do neurovascular at all and just stick to general vascular if needed. So depending on what your interests are, there's scope to further refine your subspecialty if you want to. It's not written in stone as such.
Thank you for this information. One of the other common question which a lot of IMGs ask about every specialty, they say, if I train in UK, what is my worth internationally? So if I want to move to another country, how will I be seen as? So if you are a UK trained in your specialty, what is the scope around in English speaking world and Middle East and all that? Do you have any idea of that?
It's quite good, I would say, especially countries like Australia and Canada. If you have completed your training and you have what is called CCT, you wouldn't need to write further radiology exams as such to enter. Australia might ask you to, once you enter and work for 2 years, they might ask you to write further exams, but it's a different discussion which requires some time. But definitely just to enter Australia wouldn't be a barrier with your FRC or post CCT. Canada is similar, where if you have CCT, you can enter without radiology exams, but they have a screening exam similar to MLE. They have some Canadian exams called MCCE, for which you have to clear the first part only. This is not radiology exam, it's like lab similar or USMLE part 1 similar exam. You just have to clear, not really score well, to enter the system. And within Canada itself, different regions require different requirements. There might be some states that might accept you without any exams, and other states might require you to do some exams. And Middle East doesn't require any exams at all. And in terms of income generated, it's quite a bit as well. It's about 3 or 4 times as compared to a UK's salary. The other thing I would like to add is the unique thing about radiology is teleradiology, of course, where you can sit in UK and even report for other places, Australia, Canada, or wherever, and you don't need to physically go over there. Again, that's lots of flexibility given radiology, but again, that's a big discussion in itself.
Thank you very much, Suhail, for all the information. This is very useful. Do you have any general advice for IMGs, who are looking at UK right now, may not be in UK? So any general advice what they should be doing and how to sort of go ahead in their careers?
If you're passionate about radiology, I think getting a radiology placement in UK is very realistic. If you know what you're doing, it's nothing that is unreachable for sure. People sometimes take a year or 2 to get in, but they get in. As long as you know what to do and you're a little smart about it, the chances are very realistic. I know for the fact that in India, getting radiology is much harder. I wouldn't say much harder, but it's a different game altogether. It's just about scoring marks or high in the exams, or you'll need lots of money to buy a seat or something. But over here, it's not just about you scoring well. The assessment is more checks you, looks into your personality a little deeper. It's not just about scoring marks. There are other things that you need to do. And as long as you do the right things, it's very much gettable. And the worth of the degree is much more in terms of how far reaching it is globally. So if you're passionate about radiology, do consider UK. It's a brilliant place to train.
Thank you very much, sir, for your time.
Cheers. Thanks. Thank you for having me.